Hello.
Hello.
Hello. Is this Mary Smith?
Yes.
Hello, Mary. I'm Zishan, one of the doctor here.
Hello.
Nice meeting you, Mary.
Thank you.
Mary, I understand you're here. You've been sent by your mom.
Yeah, I don't know, doctor. She forced me to come here and to discuss some things with you. Although I was not. I think you can understand. I was not, keen to come here, but she forced me and she sent me here.
Oh, I must say your mom is very caring and I appreciate you're here. Definitely, I would be helping you for everything you're concerned about. Okay, you happy to discuss with me why your mom is worried?
I don't know, doctor. She believes something is wrong with my brain, and my teacher believed this as well. I'm not able to complete my deadlines, my homeworks, and not able to maintain my focus on certain things. I don't know what's wrong with me, doctor.
Oh, well, then thank you for coming in. And I appreciate that you brought those issues and must be affecting your life.
Yeah.
And I will be helping. So I'll try to divide my consultation. You mentioned about your focus and not getting the things done. Is that right? So
yeah, doctor, I know I'm not a psychiatric patient, but I believe there is something wrong.
Yes, exactly. So, shall I proceed with the focus first so that we will find out what? So regarding the focus, so specifically few questions that will help me to find out what sort of problem you're having with your focus. You're not able to maintain focus at all, or you lose your focus on certain things?
Yeah, I try to think very happily, but at certain point, my focus got distracted. I don't complete that project.
Okay. And in terms of projects, it is with all type of projects or just daily tasks, Everything. And if you do anything interesting, you able to maintain your focus for longer, or is for everything you're not able to?
Yeah, I don't know. I found every project interesting at first. When I started, I feel happy about that. You won't believe I do 70 to 80% task in just some minutes or hours, but then I left.
Oh, I see now. Okay. What about forgetfulness? Do you think you forget deadlines? This is what you mentioned about your... Yeah, definitely. That's why your teacher might be concerned about. So, and you try doing it and you're not able to finish it and submitting it.
Exactly. That's the matter.
Have you done anything like calendar or anything before and still not helpful?
No.
Okay.
Yeah.
I see. And what about overall? If I talk about your focus previously, since your childhood, has the same thing or evolved over the time?
I think it's same. Yeah.
Okay. Thinking about few more things. Anybody told you that you are over talkative in the social events?
Yeah, doctor. I don't start, but once I start talking, I cannot shut my mouth.
Okay.
I keep on talking. Even the unnecessary things, I overshares, and I have been trouble to so many relations and family members.
Oh, that's fine that you
overshare.
Oh, I see. So that's fine. It's good to be overshare. You must be having a good friends as well. So do you think that you keep up with your friends or you?
No, because of this oversharing. They don't trust me now.
Oh.
I don't know why I do this. I don't have intent, but I do this.
You mean that you keep talking and...
I cannot keep their secrets.
Okay. And what about your friends tell you that you cut them off while they are talking and you're just not able...
Yeah, exactly. I don't allow them to speak even.
Okay. And what about things apart from that in terms of your social situations, like when you're putting focus on anything like listening to anyone and you're reading stuff,
it's very hard. Yeah, it's very hard to listen to someone, and it's hard to read books. But whenever I found some interesting, you can say the flashcards or something like that, I do enjoy it.
Okay. That's fine. That's good. So, well, overall, it's affecting you. So I'll be asking a few more questions to rule out certain things, then I'll come to on that. Okay. And in terms of, anybody told you that you seem very hyperactive, like you're always on the battery, you're okay. And overall, what do you feel about that? You feel that you are overwhelmed by all of these thoughts and everything?
Yeah, but I enjoy them and I energetic and positive person, but I get bored of my task very easily.
Okay.
I feel overwhelmed.
Right. And how's your mood if you have to grade in mood all the time? Like
Yeah, it's fine. It's fine. Nothing wrong with
Good.
it.
When you wake up early in the morning, how's your morning? You feel overwhelmed?
It's very hard, yeah.
And it's difficult?
hard to get out of bed.
Very difficult, and you feel like you're not able to do certain things. All right, okay. Well, moving on, overall, that you think like, do you think that people are talking about you? These are some odd questions just to rule out a few more things, okay. Overall, you feel good about yourself in life, hopeful about things. Okay, well, I appreciate that you're coming here today. And moving on a little further, past medical history, do you not have any problem with any mental health issues? Nothing. Okay. Any problem with the law?
No.
So, by any chance, just a standard question, you use any recreational drugs?
No, definitely no.
Excessive use of alcohol?
No.
Well, thank you. I mean, lifestyle.
I drink coffee a lot.
Oh, okay, good. That sometimes coffee can help as well with you like thing and maintaining focus. And in terms of exercise, do you do exercise?
Yeah,
do you think exercise helps? Okay, right. So it's going on, and your parents are concerned, your teacher concerned. You must have given thoughts, or you read about that, what it could be, or
I don't know. I believe I'm not a psychiatric patient.
yeah.
There is something wrong with my brain. I understand.
Okay, I understand now what you're trying to say. Last question, any family history of any condition? No, nothing. Well, thank you very much. So at this point, I'll take a quick observations and to check your BP, that's it. I'm going to explain today why I'm going to tell you what I'm suspecting. So I'm suspecting a condition which is a neurodiverse development, in which the brains can develop differently from the normal people, not neurotypical people. The condition which I'm suspecting, it could be ADHD or ADD, depending upon your symptoms. I'm not making a definitive diagnosis because this would be done by a specialist psychiatrist, okay? Do you know what ADHD is?
No, I didn't know.
Okay, I'll explain that to you now. Then I'll tell you what are different pathways I can help you with. So basically, ADHD is basically executive dysfunction. I would have to use a disorder, but I personally believe it's not a disorder. It's just a different type of brain and different functionality of brain, and it is related to the regulation of hormone, we say dopamine. That's why sometimes you lose interest when your dopamine level go down, and you need some more dopamine to get into the interesting task. So that's totally fine. It has some positives as well, and you mentioned that you can focus and finish lot of tasks, and then you have some problem with that. But I'm more than happy to provide you help, because I'm thinking you do need referral to the psychiatrist, but the waiting time is very high. There are 3 options. You want me to discuss those options? Those options are basically, I would say that one is you can take a private appointment because it is affecting your life, and the second option would be right to choose. And the right to choose, what I would send you a checklist of your symptoms. You send me back, and we will send this to the clinic chosen by you, and the waiting time is slightly less there. Okay, you happy to do that?
Yeah.
Okay. What would happen there? They would assess you, they will make a diagnosis of ADHD or ADD, and they would start you on medication stimulants.
Okay.
That would help you, and they will titrate that medication, and they will send you back to us so that we can continue our medication.
That's good to hear.
After that, you will be able to get more focus and everything, but that's, you need to wait and wait for the diagnosis. And in the meantime, you can change some lifestyles, take some supplements. I'll give you some reading material you can read on that, which can help. And I would say this is a different brain. It can be something very helpful for you. And just to keep you positive, you are doing already well. You'll be okay, and you'll cope up, but in a different way. Nice to meet you. Thank you. Bye.
Thank you so much.